What's the difference between a minor cut and a life-threatening infection? Well, it all boils down to this incredible microscopic battle that's happening inside you right now. And today, we're going to dive deep into the world of antibiotics. They're our greatest weapon in a war that, frankly, we're dangerously close to losing.
Okay, so to really get a grip on the threat, you have to understand the speed. I mean, we're talking fast. Bacteria just split in two, and they do it over and over. Get this, in less than a day, just one single bacterium can explode into billions. Billions! That kind of explosive growth is exactly why a tiny infection can suddenly become a massive problem. It's like this silent, invisible invasion, and the scale is it's mind-boggling.
So how in the world do you stop an invasion that you can't even see? That's the billion-dollar question, right? And for about 100 years, we've actually had a pretty amazing answer. But to really get how our solution works, and more importantly, why it's starting to fail, we've got to start by understanding the invaders themselves. All right, first up, bacteria, the invisible invaders. We're going to take a look at the microscopic world inside all of us.
So how does it all begin? Well, it starts with an entry point. It could be a cut, something you breathe in, or even something you eat. And once they're inside, your body is basically the perfect 5-star hotel for them. It's got everything they need to multiply like crazy. And that invasion, it immediately sets off your body's alarm system, the inflammatory response. You know that fever, the pain, the swelling? Yep, that's your body screaming, "We've got intruders. The fight is on."
Okay, now not all bacteria are created equal. We basically split them into two major classes, gram-positive and gram-negative. Think of it like this. Gram-positive bacteria have a thick but relatively simple cell wall. It soaks up this purple stain, which is how we identify them. But gram-negative, they're trickier. They have a thinner wall, sure, but they've also got this extra outer membrane. It's like an extra force field. It makes them not hold the stain, and, this is the really important part, it often makes them way more resistant to our drugs. Knowing which one you're fighting is absolutely crucial for picking the right weapon.
Okay, moving on to your body's defense system. We're about to talk about drugs, but let's not forget, you've already got a full-blown army on your side. Your immune system? It is constantly, 24/7, fighting off invaders. Antibiotics are amazing, but they're not meant to win the war all by themselves. They're more like the air support coming in to help the troops already on the ground.
But what happens when that internal army is, well, weakened? That's what it means to be immunocompromised. It's a state where your immune system just can't fight effectively. And this can be because of all sorts of things: malnutrition, old age, certain medications. When that happens, even bacteria that are normally harmless can suddenly cause a massive infection. And in those cases, simple stuff like washing your hands becomes just as important as any powerful medicine.
All right, so the stage is set. We've got the invaders, we've got our body's defenses. Now let's bring in the heroes of this story. Antibiotics, the magic bullets. I mean, these drugs completely changed the game. They turned infections that were once a death sentence into something totally treatable. They really were magic.
So how does this magic actually work? Well, it all comes down to a brilliant principle called selective toxicity. The core idea is, how do you kill the bad guys without hurting any of the civilians? Simple. You attack something the bad guys have that the civilians don't. A perfect example is the bacterial cell wall. Lots of antibiotics go right after it. But here's the kicker. Our human cells? We don't have cell walls. So the antibiotic can go on a rampage, destroying the bacteria while leaving our own cells totally unharmed. It is an absolutely brilliant strategy.
And when it comes to strategy, there are basically two main approaches. You can kill them, or you can slow them down. The first type, bactericidal, these drugs go for the kill. It's a direct assault designed to make the bacteria literally burst. Then you've got the bacteriostatic drugs. These are a bit more strategic. They act like a siege, cutting off the bacteria's ability to grow and reproduce. This basically stops the invasion in its tracks and gives your own immune system time to come in and clean up the mess.
So we've got this whole anti-infective playbook with three main ways to win. Play number 1, destroy the cell wall. Just blow it up, causing the whole bacterium to burst. Play number 2, block their protein factory. This means they can't grow or repair themselves. It's like a total infrastructure shutdown. And play number 3, scramble their blueprints. We're talking about their DNA and RNA. If they can't read the plans, they can't reproduce. Game over.
Now, for decades, this playbook, it worked, like almost perfectly. But here's the thing about our enemy. They learn. They adapt, they evolve. And now, because of that, we're facing what might be the single biggest threat to all of modern medicine. What happens when the drugs stop working?
So, what exactly is antibiotic resistance? Put simply, it's evolution happening in real time, right in front of us. Any bacteria that manage to survive a dose of antibiotics get to pass on their survival tricks to the next generation. You do that enough times, and pretty soon, you've got a whole army of bacteria that just aren't affected by the drugs anymore. Our magic bullets start to just bounce right off.
And you won't believe how clever these bacteria have gotten at fighting back. I mean, some of them produce enzymes that literally act like scissors, chopping up the antibiotic before it can do any damage. Others build up their defenses, reinforcing their cell walls so the drug can't even get in. Some are even sneakier. They change the shape of the target so the antibiotic has nothing to lock onto. And get this, some have even developed these tiny little pumps to physically throw the antibiotic back out if it manages to get inside. It is a full-blown microscopic arms race.
And this really gets to the heart of the problem. Survivors pass on resistant genes, creating stronger generations of superbugs. Think about it. Every single time we use an antibiotic, it's like a pop quiz for the bacteria. The weak ones fail, they die off. But the few that survive, for whatever reason, maybe a random mutation, maybe they were just tougher, they are the ones that get to reproduce. And that right there is how we create these superbugs.
And this isn't some far-off future problem. It's happening right now. Take something like MRSA. It's a staph infection that's resistant to a whole bunch of our standard antibiotics. So to treat it, doctors have to pull up the big guns, these last resort drugs like vancomycin. The problem? Vancomycin is pretty toxic. It can cause serious side effects like kidney damage. So doctors are stuck making this impossible choice. Do we risk the dangerous side effects of the cure, or do we risk the infection itself? That's the brutal reality we're dealing with.
Okay, that all sounds pretty bleak, I know. But here's the good news. This fight is not over, not by a long shot. And the power to protect these miracle drugs, it doesn't just belong to scientists in a lab. It belongs to all of us. Here's how we can all help.
So here's your personal role in preventing resistance. And it's actually pretty straightforward. First, and this is a big one, always complete the full course of your medication, even if you start feeling better. If you stop early, you might be leaving the toughest bacteria alive to multiply. Second, use these drugs only when they're actually necessary, meaning for bacterial infections. They do absolutely nothing for viruses like a cold or the flu, so don't pressure your doctor for them. Third, follow the dosing schedule exactly. This keeps a steady amount of the drug in your system so the bacteria never get a chance to recover. And finally, never ever use leftover antibiotics or share them. Every infection is unique, and you need the right tool for the job.
Look, antibiotics have saved millions and millions of lives. They're the foundation of so much of modern medicine, from major surgeries to cancer treatment. But we have to ask ourselves, are we prepared for a world without them? The question really isn't if we could lose them anymore. It's about what we're all willing to do right now to make sure that never happens.